this video, I'm going to tell you 3 key differences between the two, so you'll know if your pain is coming from the rotator cuff or if it's from your bursitis. First, let's start off with rotator cuff pain. Your rotator cuff pain most of the time is going to be localized on the shoulder, going down the upper arm area. And the pain is triggered by active movements such as overhead activities, reaching behind the back, or resisted activities. And the treatment for rotator cuff pain may include rest, ice, and anti-inflammatory medications, but it can also require more intensive treatment such as physical therapy and possible surgery if you have a rotator cuff tear. Now let's talk about shoulder bursitis pain. Bursitis pain most of the time is localized on the shoulder area, and the pain can be with active movements because of the inflammation, or it can be with passive movement as well. And bursitis pain typically responds to rest, ice, and anti-inflammatory medications. Worst case scenario, the injection can help.